Welcome. Today, we're delving into Kallmann syndrome, a rare genetic condition that affects the reproductive system and sense of smell. Kallmann syndrome primarily stems from genetic mutations. Several genes have been implicated, including ANAOS1, FGFR1, FGFPROKR2, and PO2. These mutations disrupt the development migration of specific nerve cells during embryonic development. While many cases are inherited, spontaneous mutations can also occur, meaning some individuals are the first in their family to be affected. At its core, Kallmann syndrome disrupts the normal functioning of the hypothalamic pituitary gonadal axis or HPG axis. The hypothalamus, a region in the brain, normally releases gonadotropin, releasing hormone, or GnRH. GnRH then stimulates the pituitary gland to produce luteinizing hormone, or LH, and follicle-stimulating hormone, or FSH. These hormones are crucial for the development and function of the gonads, the ovaries in females and the testes in males. In Kallmann syndrome, the hypothalamus fails to produce enough GnR because GnRH secreting neurons are not properly formed or don't migrate to the correct location in the hypothalamus. This GnR deficiency leads to hypogonadotropic hypogonadism, meaning the gonads are underdeveloped and produce insufficient sex hormones like testosterone and estrogen. Simultaneously, the olfactory bulb, responsible for our sense of smell, is also affected during development, resulting in anosmia or hyposmia, the inability or reduced ability to smell. Kallmann syndrome is considered rare. Its exact prevalence is estimated to be between 130,000 to 1 in 50,000 in males, and less common in females. However, these figures might be underestimates due to potential underdiagnosis or misdiagnosis. The condition affects individuals worldwide, with no known predisposition to specific ethnicities or geographical regions. The signs and symptoms of Kallmann syndrome can vary in severity. A hallmark sign is delayed or absent puberty. In males, this can manifest as small tests, lack of facial hair, a high-pitched voice, and decreased muscle mass. In females, it presents as a lack of menstruation or infrequent periods and underdeveloped breasts. Both sexes experience infertility. Importantly, many individuals also experience anosmia, the complete absence of the sense of smell, or hyposmia, a reduced sense of smell. Other less common symptoms can include cleft lip or palate, kidney abnormalities, and neurological issues like mirror movements, where one hand involuntarily mimics the movements of the other. Diagnosis of Kallmann syndrome typically involves a combination of clinical evaluation, hormone testing, and genetic testing. A doctor will assess the patient's medical history, including any family history of delayed puberty or anosmia. Hormone blood tests are performed to measure levels of FSH, LH, testosterone in males and estradiol in females. Low levels of these hormones, combined with absent or delayed puberty and anosmia, strongly suggest Kallmann syndrome. Genetic testing can confirm the diagnosis by identifying mutations in the genes associated with the condition. MRI imaging of the brain may also be performed to assess the olfactory bulbs and hypothalamus. While Kallmann syndrome is primarily categorized as a form of hypogonadotropic hypogonadism, it's worth noting that there is genetic heterogeneity. This means that different gene mutations can lead to similar symptoms, but the underlying cause is still GnRH deficiency. The specific gene mutation identified can provide some insight into the potential severity and associated features of the condition. Currently, there is no cure for Kallmann syndrome, but treatment focuses on managing the hormone deficiencies and promoting sexual development and fertility. Hormone replacement therapy is the primary treatment approach. In males, testosterone injections, gels, or patches are used to stimulate puberty, promote muscle growth, deepen the voice, and improve sexual function. In females, estrogen and progesterone therapy is used to induce menstruation, develop breasts, and maintain bone density. For individuals desiring fertility, specialized fertility treatments such as pulsatile therapy or gonadotropin injections can be effective in stimulating sperm production in males and ovulation in females. Unfortunately, Kallmann syndrome is a genetic condition, and therefore there are currently no known preventative measures. Genetic counseling is recommended for families with a history of Kallmann syndrome who are planning to have children. This can help them understand the risk of inheriting the condition and explore available reproductive options. The prognosis for individuals with Kallmann syndrome is generally good with appropriate treatment. Hormone replacement therapy can effectively manage the hormonal deficiencies and allow for normal sexual development and function. Fertility can often be achieved with specialized treatments. With consistent medical care and support, individuals with Kallmann syndrome can lead fulfilling and productive lives. Current research is focused on further understanding the genetic mechanisms underlying Kallmann syndrome and developing more targeted therapies. Gene therapy is a potential future avenue for treatment, aiming to correct the underlying genetic defects. Additionally, research is exploring ways to improve the accuracy of diagnosis and predict the severity of the condition based on the specific genetic mutation.